It's time for Stepping Out with D. Lachey and street reporter Everett Anderson. Stepping Out, the show that encourages you to step out of the box of ordinary and into the extraordinary. Stepping out of the box into a life of liberty and rejuvenation. And now, here's your host of Stepping Out, D. Lachey.
Welcome to Stepping Out. I am your host, D. Lachey. Today we have a show that will open the floor for debate amongst viewers. My Stepping Out family, I'm talking about behavior issues and whether or not it is a medication or corporal punishment issue. Joining me today is a mother who says 3 of her 8 children receive psychotropic to control destructive behavior such as tantrum and self-mutilation. Please help me welcome Ms. Connie Hull. How are you today?
I'm fine. How are you?
I'm doing great. Thank you for joining us.
Oh, thank you.
So let me ask you, how old were your 3 children when you first found out that something wasn't right?
Well, actually, it's 4, but my oldest does not live with me anymore. He was diagnosed at 12. My second one was diagnosed last year at 10. Okay. And my third was diagnosed last year at 8. And then my baby girl was diagnosed this year in April.
So tell me what led you to the point of them being on medication or you recognizing that something was wrong. What was going on?
Honestly, with my oldest, he was just having difficulty getting along with teachers, students, anybody. He was just having problems focusing, and he had started seeing things. He was diagnosed with a schizoaffective disorder, and he's manic depressive. So he had his issues were a little more severe than my other kids. And when he started seeing things on a regular, people standing in corners, people standing at the door, it just scared me. That wasn't just acting out.
Right.
That wasn't, to me, seeking attention.
Right.
Something else was going on.
So how did you deal with that? Was their father there, or was it a mutual thing you all discussing together? Or?
It was a mutual.
Okay.
My ex-husband was raised that you don't talk about certain things in the home, and that's to me a bad issue with African Americans, that we don't discuss mental health, and it really makes it worse.
Right.
So no, he didn't help, and I pushed the issue. I pushed it, and because I wanted Darius to be okay. I wanted him to know that he was normal. He
was the first child to be diagnosed.
Yes.
How did he relate with the other children?
He did not. He was hospitalized 5 times for attempted suicide. He was a self-mutilator, and he took his anger out on the kids. So he had to be removed from the home a lot of times.
So when you say self-mutilator, what do you mean by?
He cut himself.
He would cut himself.
Mm-hmm.
So your other 3 children that are in the home with you now, do they have the same diagnosis?
No, they do not. Well, the second one, he has post-traumatic stress disorder, and he's also manic depressive. The third is ADHD with impulsive disorder, and then I have an ADHD with inattentive disorder.
Okay, so how do you deal with that from day to day?
I am in survival mode. That's where I'm at. I just do what I got to do. I keep it moving. I make sure they get to their appointments. I make sure they have case management. I make sure they take their meds. Keeping an eye on them. My oldest helps me a lot. I appreciate that. But outside of that, it's just me and them.
How did you get to the point where you realized that it wasn't a behavior issue, it's something else that's going on? For a mother out there that may be dealing with a child that's acting out, how did you know that, hey, it's not just being bad and just needing a spanking?
Okay. To be honest, I was a spanker. I gave spankings, and that wasn't helping. It was spank, and then they would go back to the same behavior, and it wasn't fixing anything. And then when they go to school and they're acting out, and okay, I come to the school, I sit in the class, they may act good for a little while, and then they go right back to the same behavior. Or they're in class and they're still acting up, and you're there, something's wrong. And then with Roy, the 11-year-old, he started pulling his hair out. He was doing things to hurt the other kids in the house. He was being destructive, very destructive. And my thing was, that's just not normal. So for me, it was because my oldest was diagnosed, I was a little more aware. Because with my oldest, I was dumb, I was stupid. I felt like
you just wasn't educated.
I just felt like the spankings would fix it.
Right.
And it didn't. And I had to learn a way to communicate with them. So I went and had him tested. I said, I want him tested to see what's going on. And they said nothing. And about 6 months after that, he hung himself.
Who hung themselves?
The 11-year-old. The rope broke. And they hospitalized him for a month. And they found out he talked. He was able to communicate some things that he wasn't able to communicate with me. So as a mother, we have to get ourselves out the way sometimes.
Right.
And know that it's nothing you did wrong. It's not your fault.
Right.
But they need to get tested, find out.
So I hope I'm not being too personal, but do you feel that your other children are safe at night?
Yeah, now.
Because of the medication?
Now, yeah.
So you can rest knowing that they're okay?
I don't rest because it just is, I wish I could fix my babies. That's just what it is. But as far as him hurting anybody, we have our moments. Like I said, we're in a crisis right now. He's starting to pull his hair out again. So my oldest is watching him, but we're probably getting ready to hospitalize again just to get his meds right, because the doctor took him off some of his main meds because they felt like it was making him gain weight, and they didn't want that. And I get him not wanting him to gain weight, but we got to do something. He's pulling his hair out. He's 11, and he has a bald spot right here in the middle of his head. And I thought he was using a razor, but I've caught him pulling his hair out one day, and I was like, "Why are you doing it?" And he's nervous. Something is going on.
Do he understand what's going on with him?
Somewhat, yes, and somewhat no. He doesn't understand the feelings of wanting to hurt himself.
Right.
He just knows that he gets real angry, and he feels like that being dead is better than living.
I'm so sorry. What about your other two children?
They're not as bad. ADHD is not so bad. That's more of my 9-year-old son. He's hyperactive. He has it's called impulsive disorder, which means where we know something is wrong,
right,
not to do it. He doesn't get that. He'll get it. He'll do something, it's wrong, he'll get in trouble, and he'll figure it out later. But initially, he doesn't get it. So I have to really watch him, and when he goes to friends' house, I kind of have to let parents know he's not doing it to take things, because he's more of kleptomaniac, pick up stuff. He doesn't realize that it's wrong to an extent, and I'm not making excuses for him. It's just, that's just what it is.
Right.
I have to stay on him and watch him. And then the little girl, she's attentive. She doesn't retain information. She'll read a book, and she can tell you what it's about at that moment. But the next day, she doesn't retain information.
Wow. Do the doctors think that what you're going through with your child, do they think it's hereditary?
Yes.
They do?
Mm-hmm.
So do you believe that parents should really have their children examined, or?
If you feel like they're acting out and you're spanking and nothing's changed, yes, go check. Who cares what everybody else thinks? Go get your babies checked out.
Right.
There's insurance for that. Most of us are on TeamCare, and if you're not, most people are on some form of private insurance. Right. Take them and get checked, because at the end of the day, you're saving them from a whole lot of other unnecessary issues that they're going to have if you deny the fact that something's wrong.
Right.
Because it's going to escalate. It's going to get worse. And I guess I should have seen things coming with the 11-year-old, but I was like, no, can't be doing this again. We just can't.
You don't want to accept it.
And
do you think accepting it is the hardest part?
Yes, it is. Very. Because as an African American woman, and as a single mom, we have so much other stuff going on. Why do I need to deal with the fact that they have a mental issue and then have to deal with stopping my life?
Right.
Doctor's appointments, med clinic appointments, and then if they're trying to hurt themselves, hospitalization. I mean, it's just difficult to want to say, okay, now I got to really focus on you more than I'm already focusing on you.
You're right. Right.
You know, so it's difficult. And then the fact that you don't have the support from family. My family has said they understand, but unless you have dealt with mental illness, you have no clue.
No clue. Thank you so much.
I appreciate it.
We will be right back with Stepping Out after this short break.
We live in a world where no one wants to be a loser. But what happens when losing means winning? What are we referring to, you ask? We are talking about inches. Yes, losing inches and shaping your body. The Stepping Out Transformation Project of 2014 is being led by the talk show host and author Dee Lachey and Miss Monica McLaurin. We invite you to join our team as we get healthy and shed off inches off our waist, our hips, arms, and every area that fat likes to tuck in and take up residence. It's time to file an eviction notice on the unhealthy areas of your life and build a new, healthier you. Are you ready? You can do it. Start making the transformation today by liking us on Facebook, visiting our website, and emailing us pictures at steppingouttalkshow@gmail.com. We are stepping out in 2014 to be healthier because we know that as we lose weight, we are winners.
My name is Vince Dixie, and I work with Bail You Out Bonding. When you're in jail and you need someone to listen to your story, we are the caring and compassionate bondsmen that you can trust. Here at Bail You Out, we do nationwide bonding. We have late night, overnight bonds because we're open 24 hours a day, 7 days a week. We accept major credit cards and cash, and we're here to serve the public. Here at Bail You Out, C-Wiz, Mayhew, and Vince are here to bail you out.
This is Everett Anderson on location. We got here, what's your name?
Stan Moore.
Stan Moore right here in Madison, Tennessee. Today's topic was about discipline versus medication. Do you think that some, doctors is forcing the parents to, medicate their children?
Needless to say, probably not. We want to stay away from medicine due to we want to give it to the parent. It's their choice. In the mental health field, typically, we want parents to use interventions like 1-2-3 Magic or more 1-2-3 Magic versus medications because typically if parents lean more towards medication, it kind of gives us the results or, just the result of that they're looking for something like maybe a check or versus something that, is going to really help the kids. So we try interventions versus medication.
Okay, from what I look at now, I guess everybody's actually being medicated versus being disciplined these days. Do you think that doctors are persuading them? Or maybe some doctors versus others?
I think when you have doctors who are typically in it for the money versus the treatment, then you ultimately are going to get, providers to say, well, you need to medicate your child. If they're really good, it's a case-by-case basis.
So do you think the parents are taking the easy way out, I'm giving them this pill so I don't have to whoop them, instead of discipline them?
Well, see, the thing about the pills is that because they're so different, they have different results. So you get a kid who has ADHD and you give them a certain type of pill, it may make them gain weight, typically making them slower, which will slow them down. Or it could be a worse result, and if you give that same medicine to a child who has like a mood disorder, then it may just accelerate their mood and then they're just all over the place. So I think the doctors and the parents have to ultimately be on one track in order to treat the child.
Okay, everybody got to be on the same page.
Yes.
To treat this, to treat them. If a kid is overactive, right? They have all the energy in the world. They run around the house. Being a kid, to me, what would you do? Do you think they have a problem?
I'm an intervention person all day.
Oh, okay.
So that means that typically we're gonna look at case studies. We're gonna look at videos. We're gonna look at increasing parenting skills and knowledge before we actually try anything with medication. Medication is always the last step for me because I feel like it's just an aid. It's just like, think of it as people that wear glasses. If you don't wear your glasses, you can't drive. So
I know I can.
yeah, so ultimately we just want to make sure that it's an aid and pretty much not an intervention in itself.
Okay, well that makes sense. That makes sense.
Yeah.
Well, appreciate you having me, giving me a little bit of your time. You said Stan?
Yes.
Nice to meet you.
Nice to meet you too, sir.
Back to you at the studio.
Thank you for rejoining us. We are talking about medication versus corporal punishment when dealing with children and behavior issues. In the studio, we have Dr. Elliott Bell of Meharry Medical College, who specializes in diagnosing and treating children with mental disorders. Thank you so much for joining us today.
Thank you for the invitation.
Thank you. So let me ask you this. What is the process of diagnosing a child to say that they have mental disorders?
Well, usually that process begins with the parent noting something in their child that they're uncomfortable with or that they've been observing through the years. Sometimes it may be prompted through behavioral problems at school or concerns that teachers or other professionals may have expressed. And so the parent would reach out to me as a psychologist, and I would interview them, get lots of information about the history and what behavioral problems and symptoms they are observing. And then I'll do direct observations of the child, sometimes do some testing, talk with other people who work with that child, because when we're trying to understand what's going on with the child's behaviorally or mentally, it's important to get information from multiple informants. And so then we just take all of that information, pull it together, and we compare it against the diagnostic criteria for a number of different behavioral and developmental disorders, and we make the diagnosis based upon the evidence that we have to support one of those.
Right. So are there any specific behaviors that a parent can look for, or like warning signs that their child may have mental disorders?
Well, I think it depends on the age of the child, of course. For small children, less than 5, we're really concerned about development again. So if the parent's concerned that their child's not talking or their child's not making eye contact with them, or perhaps the child's not interacting with friends the way they would expect them to at that age, then would be concerned. If it's an older child, I'm always concerned about changes in behavior. So if the child's been developing and getting along with peers, learning okay, and then all of a sudden you see some changes in your child's grades, maybe they plummet, or they stop wanting to hang out with their peers, or they become really anxious or beginning to gain or lose weight really rapidly, then I'd be concerned that that child may be struggling with some type of emotional or mental disorder.
How is it possible to distinguish between a mental disorder and a child just being manipulative? Kids with new technology and all these things, kids are actors and dramatic nowadays.
Yeah.
So how can you distinguish between a mental disorder versus a child that's just very manipulative?
Absolutely, especially teenagers.
Teenagers playing against your parents and,
Well, and I think that's where it takes getting lots of information. We want to get a history of what the pattern of behaviors have been like through the years and also across settings. If a child's only acting out with mom, but she's fine when she's with grandma, she's fine at school, she's fine with dad, and fine with her friends, then you might expect that, she's getting something from that relationship with mom, or she's seeking something from that relationship with mom.
So it's not necessarily mental disorders.
Yes.
Maybe they're not. The relationship is damaged.
If she's overly dramatic with mom because mom tells her she can't, have her cell phone that evening, but, dad or grandma or others can place the same limitations, and there may be some other issues going on there. Doesn't mean that she is not struggling emotionally and have some things that we need to work through, but that's where I think a good diagnostic interview and the diagnostic process is so valuable in trying to make that distinction.
Okay. So for the parents out there that believe in spanking children, as a doctor who deal with children with mental disorders, do you promote spanking or think that or feel that a child should be examined, or how do you feel? Is spanking okay for children that have mental disorders? Do that help, or does it hurt more?
What a loaded question.
I'm sorry.
Let me try to unload here.
Okay.
I think, whether or not spankings are effective, I think the literature has been mixed. A lot of people are concerned about the long-term effects of spanking. Spankings can bring about immediate consequences, or it can be an immediate tool or strategy to use, but typically it doesn't last, so the child may avoid the spanking once, but it doesn't teach the child why that behavior was a concern initially, or what they could have done differently in that situation. So from that perspective, I think spanking is not the most effective tool that parents can use. And oftentimes, by the time parents come in to meet with me, they've tried spanking and they've tried, some other things, and it's not working for them. And so my role is to help them look at other strategies they can try to use to help manage that child's behavior.
So it's nothing wrong with a parent coming in and seeing you and getting a consultation if they just worried in the beginning. They don't have to wait to get to an extreme situation such as suicide or things like that before they reach out to get some help.
Absolutely. I think that prevention is key. So, and a lot of times parents will get that kind of education and information from their primary care providers,
right,
such as the pediatricians that I work very closely with at Meharry. So
right,
they're talking with them about types of things to expect and how to promote their child's behaviors, and what some red flags are that they
right,
should be on the lookout for. But absolutely would love to be proactive at getting
right,
parents, if they have concerns. Sometimes it's just this gut feeling that something's
right,
not quite right, and so we
right,
encourage them to talk with their pediatrician or other provider. And if it reaches a level where they'd like to have a consultation, then absolutely, would much rather do that than...
It's interesting that you say that, because as people, we get the physical checkup, and we get physicals, we get shots, we get our yearly exam to make sure that everything is okay. But typically, you never hear people just go for a checkup or have themselves examined mentally. It's always once it's really, really bad before we go.
And that's why I'm thrilled to be here today, just to be able to, or begin to have conversations and reduce the stigma associated with mental, behavioral, and psychiatric disorders. I think we have to have those conversations, because there's a lot we can do on the preventive end, prevent or intervene much earlier before it gets to the point where a child's acting out through alcohol and drug experimentation, or cutting, or suicidal gestures. So
at your clinic, do you have the task of admitting children to facilities, or is your job pretty much just medicating and treating the child?
Okay, so I'm a psychologist in the Department of Pediatrics at Meharry, and so primarily we run an outpatient clinic.
Okay.
However, if a child comes and they are in distress, and I determine that they are a risk to themselves or others, then by law I have to intervene and help keep that child safe by facilitating getting them admitted into a hospital that can address their needs and stabilize the situation. I also need to correct, I'm a psychologist, and so with that said, I don't prescribe any medications, but I do work very closely with a developmental pediatrician in our practice and our Department of Psychiatry if need be, so that we can get children the appropriate level of intervention that they need.
So if there is someone out there that is concerned about their child, or just want to have a consultation, or just talk with you, or make an appointment with you, how can they contact you?
Sure.
Or your clinic? Sure.
We invite them to visit our website, Meharry Medical Group, and they can reach us at mmc.edu, as in meharrymedicalcollege.edu, or they can contact me by phone at 615-327-6348.
Okay, thank you so much.
Thank you so much.
Let me just ask you, how long have you been doing this?
Ooh, I've been doing
Without telling your age.
I know, that's exactly where I was going with this.
I don't want to offend you.
No offense at all. But I graduated from, earned my doctorate in 1998. So I guess technically began practicing then. So about 16 years.
Okay, so
14,
children
16 years.
and
Wow. Yes.
mental psychology and children is
Yes.
your passion?
Yes, it absolutely is. And again, I just appreciate being here and being able to have this conversation. And, you know, so if a mother is struggling and a lot of times it's not a real struggle yet, but it may be just kind of this gut feeling or sense that something's
Right.
not quite right with their child. You know, if the child's younger, and then older, you know, maybe they do feel that they've tried a lot and it's not quite working, and they just need somebody to talk to. You know, in addition to grandma and the aunts in the family and other parents, you know, sometimes having a neutral third party come in, assess the situation, and help make some determination about whether a professional level of intervention is needed.
Well, thank you so much for joining us today, and I really appreciate you telling us about Meharry Medical College, Meharry Medical College, and everything that they do to help children and help families that may be in this situation.
Yes.
Because it's a stigma, and a lot of people don't like to talk about things that are going on in their home with their children.
Absolutely, and again, many thanks to you and the producers.
We just had a very informative conversation. Thank you, Dr. Bell. We will be back with more Stepping Out after these messages.
Thank you for watching Stepping Out with D. Lachey. We hope you are uplifted, motivated, and encouraged. If you'd like to be a guest on the show or become a sponsor, call the number on the screen or visit steppinouttalkshow.com. Stay up to date with Stepping Out by liking us on Facebook and following us on Instagram and Twitter. Be on the lookout for contests, giveaways, and behind-the-scenes footage you can only see online.
We'd like to thank our guests, Ms. Connie Hall and Dr. Elliott Bell, for joining us today and shedding light on an issue that is overlooked and many times swept under the rug. If you or someone you know is experiencing behavior issues out of a child not considered normal, contact your doctor and ask for help. They can make mental health referrals and get you the support you need. Until next time, I'm D. Lachey, and this is Stepping Out.